Our department has a lot of leaders in the hospital. And so we were hearing about kind of changes that were coming pretty imminently. And so I met with our program director and we started to get together, make these plans. And within 2 days of us making kind of those backup plans, we were kind of in the midst of deploying them.
We went from very quickly from kind of regular residency to complete shutdown where almost everyone was at home. It was really just a skeleton team in the hospitals. Cases were canceled. Our didactic structure was changed from in-person weekly, multi-times weekly events to like daily a couple hours of Zoom sessions. Our faculty really kind of worked together to put together lectures. It was just a lot of changes, very sudden.
So when I think of 2020, I think of a lot of different things. Obviously, there's the pandemic, but on top of that, I ended up buying a house around the same time. I have been planning a wedding, which has been complicated by COVID. So I think there are a lot of great experiences during that time, but obviously always overshadowed by the pandemic.
I'd say when I think about my 2020 residency experience, it was my last year of training. So it was kind of unique experiences that I was kind of senior enough to, be handling and doing things on my own. And I feel like the pandemic forced me to do that even more so, but also do it more so in the department, like within the other attendings.
When I think of 2020, it just seems like things were changing every day. Like as a resident, it's every single day there seemed to be new information, new policies, new ways that we were trying to keep ourselves safe and keep our patients safe. So I saw us come together a lot as a residency class, having weekly, if not more than weekly meetings. Vandra was obviously instrumental in keeping us all informed through her role as administrative chief. But really, I think we're all, most of us in medicine are very used to having things planned out and having things in control. And really, this is a year that you cannot plan out. Kind of plans are just changing on a day-to-day basis for really the whole year.
I'd probably say my most significant challenge was that one, again, like I said, it was part of the end of my training, and there were things that I was, fearful about and trying to fine tune. And, because of how things were, we were doing a lot less cases. Although I do feel happy that, like Elaine said, we, as otolaryngologists, we weren't necessarily always on the front line of things that were going on, compared to our ED docs, our ICU docs, although a number of people in our department definitely stepped up and helped out in those areas when they could. But whenever I did get the chance to, do a trach or help someone that was going through the sequelae of COVID, I felt like I was finally kind of pitching in and doing my part.
For me, actually, the hardest thing about it was feeling really useless. I was watching my colleagues and not only in my program, but also my friends in other programs, my attendings, people I'm close with. I'm watching them sort of navigate these new challenges and really kind of be on that front line. And meanwhile, it was my job to continue doing my research and stay home. And, I was working from home because I was luckily able to do my projects in that way. But I felt really, it felt really strange to be a physician in a pandemic and not using my skills.
Yeah, when I think back to my biggest challenges, I mean, I can definitely echo what Elaine and Vandra said. And also it really hit home when I actually contracted COVID, and I was the only resident in our department who did, even though I was also on my research time. And I think that took a while for me to get over it from a health perspective, but also from an emotional perspective, because there's so much still unknown about it. And even still, we're learning about what are the long-term effects.
I volunteered to work in one of the COVID ICUs for a 3-week period because it was really at the point where we didn't know how bad it was going to be in Baltimore. It was a little bit scary. I remember watching the PPE videos like a couple of times about how to be safe to protect yourself when you're moving in and out of these units. But then it became very routine. You're watching these amazing like physicians, nurses, respiratory therapists, all these people who just kind of figured it out together and learned how to take care of these patients, even though it was in units that was not their usual patient, surgical ICUs turning into medical ICUs and pediatric ICUs turning into COVID adult ICUs. It was a lot of people being flexible.
I remember similar to Elaine, I was also in the research tract, and we were prepared to sort of take backup call, and I'll never forget like how ready we were, like in terms of a residency program. We just had everything in place that in case it got really bad, in case half of our residents were going to go get sick, or if anything happened in the wards, then we'd be able to step in. But fortunately, it never came to that. I think we had a good enough plan in place in the beginning that really helped prevent it from getting worse.
I think the COVID-19 pandemic and having to see patients in a different way really highlighted all the different tools we can use to accomplish patient care, whether that's seeing a patient on telemedicine initially, getting labs ordered, because especially if it's a family or someone that's, taking care of someone else, it can be hard to get to doctor's appointments. For our pediatric patients and families, I think that can be difficult. And so I think this is a really good avenue, even from some post-op checks, initial meetings with patients to get the ball rolling on things. I think we can get things done a lot quicker that way. But I do think that you still have to be diligent in fact that it is a disparity still for people that don't speak English as their primary language, because we don't have the best tools kind of easy set in place to do translation services through it. But I think it'll be a great tool that we still need to fine tune.
Yeah, when I think of what we hope to take away within otolaryngology practice, I mean, I definitely think telemedicine is huge, because a lot of times, as physicians, we don't want to change, right? We're really reluctant to change. And I think being forced to and actually finding the tools to adapt our practices has been a huge step forward. But then again, as Vandra said, we do have barriers that we still need to overcome. There are people who don't have internet at home. And we have to really consider how we can use telemedicine to our advantage, but also to make sure that we meet those obstacles for our patients.
One thing that I really missed over the last year is seeing my co-residents in person frequently. Like, we are close, and it's interesting. The first time I think we've all seen each other as a group in one room was just a few weeks ago, because we met for a socially distanced in-service exam. And I was actually kind of floored to realize like how much like I really miss seeing all these people in person. Like, we are just little Zoom screens all year. So I'm just very hopeful that over the next year, as things return to normal, we'll actually get to see each other, spend time together, continue to take good care of patients, but continue to enjoy being friends as well.
I really miss having the weekly didactics where we can all just sort of debrief after a day and just hang out.
Someone who's just finished residency, I do feel like overall, just as a residency program, it prepared me greatly to be an independent thinker and to come out and kind of do my own procedures. It's residency. I feel like anywhere it's tough, and our attendings in particular always want us to be doing our best and make sure we're doing a great job. And that really has translated to me being able to, not easily, nothing's easy, definitely still learning, but kind of go in and have a lot of confidence when I talk to my patients, and I talk to them saying things that I learned exactly from my attendings. And, they're like, no one has ever talked to me like that. No one's ever explained anything to me like that. So you're a great doctor. And so my being a great doctor has a lot to do with my training at Hopkins. And I think it's a great training program, and that, any otolaryngologist that went to the program and graduated from it would come out being a great otolaryngology, ready to go out and lead in wherever area that they're deployed in.